Okay, we continue to the meridian theory, stomach channel of the foot Yang-Ming. Okay, good afternoon, Doc. Good afternoon po sa lahat. Continue po tayo sa meridian theory, stomach channel of foot Yang-Ming. The stomach meridian starts below the eye, near where the large intestine meridian ends. It does a U on the side of the face ending at the temple. So there is letter U na curve po yung path ng stomach meridian. The rest of the meridian flows on the neck, thorax, over the breast, the abdomen, and the front of the thigh, shin, foot, and ends on the lateral side of the second toe. It is the only yang meridian which does not follow the rule that yang meridians flow on the lateral and dorsal sides of the limbs and body. The meridian flows on the front of the body and the legs. So, nasa harap po siya ng path ng meridian. The inner branch flows parallel to the exterior meridian on the thorax and abdomen, entering the stomach and the spleen. Another branch is given off at point stomach 36 and flows to the big toe, to spleen 1, and to the third toe. So first, we have the stomach 1. The location with the eyes looking straight ahead directly below the center of the pupil, between the eyeball and the infraorbital ridge. So dito po yun sa may mata. The point explanation, the first point and point of entry from the former large intestine meridian. Stomach 1 is very effective point in the treatment of eye diseases such as optic nerve atrophy, short sight, macular degeneration. When treating the eye problems, this point is needled between the optic ridge and eyeball into the optic cavity, about 2 centimeters deep. As an entry point on the superficial energy circulation, it can be needled subcutaneously 2 to 3 mm. So, tingnan po natin yung location ng stomach 1 dito po sa may mata. Next, we have the stomach 3. Ang location niya with the patient looking straight ahead, directly below the center of the pupil. So, i-align po sa center ng pupil on the level of the lower border of the ala nasi. So, a point explanation, a local point for maxillary sinuses, as it is quite close to the point LI-20. It is often needled towards it. So, pag needle, papunta po sa may LI-20, getting both points with one needle. Okay, dito po sa may side ng nose. Stomach 4, next point, we have, it's located with the patient looking straight ahead, directly below the center of the pupil, approximately 0.4 chin, lateral to the corner of the mouth. So, i-align din ulit sa center ng pupil, then nasa may side po ng mouth. Point explanation, this is used mainly for the lips, cracks, or inflammation at the corner of the lips, or in facial paralysis when the corners do not turn up into a smile. This point should be given with skin pinch and needled away from the corner about 2 cm deep. So, ipipinch po yung skin, saka po mandible. Pa-side ng corner ng mouth. Next, we have the stomach 6. Ang location with teeth clench on the highest prominence of the masseter muscle, approximately 1 finger breadth, yung middle finger, anterior and superior to the angle of the jaw. So, ito po ay bite natin yung patient and yung higher prominence po nung dito sa may jaw Yun po yung stomach 6. Sa point explanation, the best use of this point is for teeth grinding during sleep. So may mga pasyente na nag-teeth grinding habang natutulog. Ito maganda po itong point. In fact, more tender points could be found in this patient along a circular line drawn from one stomach 6 to the other, both front and back. The other points on this line are triple warmer 17, dito po yan sa may likod ng ear, GB12, dito din sa may back ng head, and GB20. These are tender, so we have to palpate these points. Kung may tenderness, they should be needled as well. So, isasabay po natin siya pag needle kung pag palpate, there is tenderness. In this case, and in the case of temporomandibular joint pain, the needle should be given perpendicular 15 to 20 mm into the point. This is a good point for acupuncture, analgesia, for tooth fillings, or extraction in the lower jaw. So, magagamit natin ito para sa mga may mga problems sa tooth or before magkaroon ng treatment sa dentist. If used, it should be stimulated for 20 minutes prior to the procedure with continuous electrical stimulation along with one more point on the same side. So, pwede rin gamitan natin ng stomach 6 kasabay po ang LI-4 on same side. Sa location ng another point, stomach 7, with the mouth closed, sasara po yung mouth, the lower border of the zygomatic arc in the center of the depression of the mandibular fossa between the coronoid process and the condyloid process of the mandible. So pag pinalpate po natin yan, may parang malambot na area dito sa may mandibular depression sa mandibular fossa. Sa point explanation, this is another point that is used to treat TMJ pain and is used as an acupuncture analgesia point for upper jaw problem. So sa may mga masakit po sa upper jaw, we could use stomach 7. The insertion in both cases is at 45 degrees angle towards the point small intestine 18. So pakatusok po natin towards the small intestine, magkakaroon po siya ng angle na about 45 degrees. Next point, stomach 8, which is at the temporal corner of the forehead. Siya po yung naglihis na stomach point on the border of the temporalis muscle. And 0.5 tune within the anterior hairline. So, paangat po siya 0.5 tune and 4.5 tune lateral to the anterior midline. So, from the midline ng head, maka-count po tayo ng 4.5 tune pa side. Then, another 0.5 tune paangat anterior sa hairline. Sa point explanation, when the patient complained of a lateral or temporal headache, ask them if it occurs on one side at a time or on both sides simultaneously. If they are pointing to both temples at the same time, this is a stomach meridian headache and not GB headache. So the point is most possibly stomach ache. So tatanungin natin ang pasyente kung ang both temporal area is masakit. We could say that this is a stomach ache headache and not a GB headache. It is the point that hurts when one has a low blood sugar headache. So pwede rin kung mababa ang blood sugar, ito po yung stomach ache ang sumasakit. In this case, it should be also disappear after eating and not after needle. So if there is low blood sugar, ask the patient to have their meal or snacks. The point can be needled perpendicularly 5 to 10 mm deep. Okay.